Thank you. Well, it's a pleasure to be on this panel with some of my most respected colleagues. And also my hat goes off to Nancy Adler for shepherding this process from which this meeting resulted. I'm going to talk in a little more detail about taxing sugar-sweetened beverages. It wasn't that long ago where such a maneuver would have been considered inconceivable. And when the idea first started getting proposed back about 25 years ago, it was either dismissed, certainly ignored by the beverage industry, which didn't consider it a threat at that time. But then around 2009, attention began to be paid to sugar-sweetened beverage taxes. And then look where we are today, a very small number of years later. The WHO, as Dr. Chan mentioned this morning, has come out with a very strong statement against the consumption of sugar-sweetened beverages and in favor of taxes to help curb the consumption. American Heart Association, supported by the amazing work from the Robert Wood Johnson Foundation, has done the same, and any number of organizations have supported the concept of sugar-sweetened beverage taxes. So what happened back in about 2009 that shifted this discussion? Well, first, the steam was being accumulated underneath the sails. Well, steam and sails don't have to go together, but you get it. For creating public health approaches to dealing with obesity and using public policy to address obesity. So things like preventing obesity by intervening in the schools with the nutrition standards was an example of how progress was being made. So taxes started getting discussed in that context. The bad economy helped the discussion along a lot because legislators were looking for sources of revenue, some of whom didn't care so much about how the revenue was raised, just that there was new revenue. Some cared about the public health implications of the tax. And then there were some scientific papers that began to come out looking at early indications of what sugar beverages were doing to health and what reduction in sugar beverages consumption might accomplish. Two such papers I was involved with in 2009. The first paper that I wrote with Thomas Frieden, now the head of the Centers for Disease Control and Prevention, presented a public health case for reducing sugar-sweetened beverage consumption through taxes, following very much on the model that had been used so successfully with tobacco. We proposed at that time a 1 penny per ounce excise tax on sugar-sweetened beverages. Various levels of tax have come about in subsequent years, but that was what was presented initially. And then the second paper was making not only a public health case for taxing sugar-sweetened beverages, but an economic case as well. Why should government get involved in disrupting the free market with sugared beverage sales? And the response to that was to look at two economic concepts, externality and information asymmetries. So that provided a conceptual basis for moving ahead. Then where are we now with sugar-sweetened beverage taxes? Well, I just compiled this list last night because it seems like every week some new place is either considering a tax or getting close to passing one. But a number of places around the world have now enacted taxes or have passed taxes, and they are to take effect in the next year or two. And then a number of places are close to passing taxes, have introduced them, or they're being proposed by prominent government officials. And this is just a partial list. I haven't caught everything. But you see major countries like France and Mexico have passed national taxes. In the United States, Philadelphia passed a tax fairly recently. San Francisco is considering one. And you can get a sense of the span around the world of this. But there seems to be so much momentum that these taxes, at least in my mind, are pretty inevitable as part of the policy picture going forward. So do they make sense or do they not make sense? You can model the impact of taxes, and Steve has done some outstanding work on that. Some other economists have estimated the elasticity of soda consumption, how much would it change if price changed by a certain amount, and that data has been very informative. But it's really until you put the taxes into effect and see how they work in the real world that you know what their impact will be. Well, two papers were published recently on the evaluation of taxes, one in Mexico and one in Berkeley, California. Both produced positive findings, which were surprising in a way. The Mexico results were surprisingly positive given the size of the tax. 1 penny per ounce tax would produce an increase in the cost of soda of about 20%. And the estimates are that that would decrease consumption between 15 and 20%. The Mexico tax is half of that. And a tax of half of that is right at that cusp where you might start to expect changes in consumption because the increased price would be enough for consumers to notice and respond to. So it was quite possible that the Mexico tax was too low to produce any noticeable change in consumption. So the fact that it did was surprisingly positive. And in Berkeley, the tax hasn't been in effect for all that long. And then also Berkeley, of course, being a small city, a lot of the shopping that people in Berkeley do may occur outside of Berkeley where things aren't taxed. So the positive effects found in Berkeley were quite encouraging as well. More time will be needed to find out how these work in the real world, what level of tax is optimal, and how consumers are responding as they decrease soda consumption by substituting other beverages or foods. And those data look positive so far, but it's really very early in the evaluation process. It's very interesting to think about what happens to the revenue, and Steve alluded to this. A sugar-sweetened beverage tax of 1 penny per ounce generates income numbers that look like this. And for the state of California, more than $1 billion would be raised annually by a tax of this level. These data are produced by the Rudd Center at the University of Connecticut. If one then deploys the resources in any way relevant to diet, health, or obesity or diabetes prevention in particular, then you could get a particularly positive benefit. The most logical use of the revenue would be to subsidize things like fruits and vegetables to drive down their cost. And there's some very interesting science to be done to help address the utility of that particular approach. So given that the taxes are a reality, momentum is building, they're likely to occur in many different places around the world, the initial evaluation results are positive, where is this going to go and what are the next generation of key issues? Well, here's some of the things I think are important. Thus far, there hasn't been much attention to indexing the taxes to inflation. And the alcohol people have run into this problem where a certain level of tax is established, but over time, that tax amounts to less money because inflation has decreased what that particular amount means to somebody. So indexing the taxes to inflation would be an important part of policy. Second is it would be natural, as happened with tobacco taxes, to ramp up the taxes over time. So my belief is that the level of taxes that you're seeing now would be the floor of what the ultimate taxes are likely to look like. They are likely to ramp up over time, and then that would have, of course, greater revenue generating potential, but also greater impact on the consumption of the beverages. Expanding what is taxed is likely to be a very important part of the public policy discussion in the future. Why are sugar beverages taxed? Because they're a major means by which sugar is delivered to the U.S. population and around the world, but they're not the only such vehicle, and hence expanding the taxes to other foods that include sugar would be an example, or fat, or whatever nutrient you'd like to focus on, is likely to be part of the public policy discussion going forward. The beverage companies have complained about the current, they don't like the idea of taxes at all, but the current taxes that apply a tax to a beverage independent of how much sugar it has is something that the beverage companies have objected to, saying that if you were taxed according to how much sugar was in a beverage, it would be incentive for them to reformulate and lower the amount of sugar in products. So it's not an either or, do you have sugar or not, but it's how much sugar you have. There's a very interesting discussion to be had about the potential public health impact on that, using that approach, and how the companies would likely respond in terms of formulation of their products. The next issue is what is the optimal use of the revenue? And here I think there is some very important science to be done. I was just up in Boston visiting Steve and his colleagues at Harvard, and I was speaking with Walter Willett, who was mentioning some very important research going on at Harvard where they're more able to specify in epidemiology studies now the particular health benefits of particular fruits and vegetables, not just looking at them as a category. Wouldn't it be interesting for somebody to do a study that crossed the health benefits of particular fruits and vegetables with how elastic their sales are when price changes? Because then, if one were to subsidize fruits and vegetables, you could find the particular ones that were most elastic, that is responsive to price changes, and produced the greatest health benefit. And hopefully the discussion will turn toward use of the revenues for diabetes and obesity prevention, and that would be a very important part of science. And then last, and I think the public health community has to gear up to address this issue, is the likelihood that the soda companies will go looking to the federal government to pass a soda tax, even though they're highly opposed to them now, but pass a small tax that would preempt states and cities from doing their own. This concept of preemption is very well known in legal circles. It's used across a variety of areas of law. And the tax policy people tell me that government does have the authority at the federal level to pass a tax that would preempt states and cities from doing one. The companies did the restaurant industry did exactly this. When restaurant menu labeling laws were passing in cities and states, they went asking the federal government to pass a very weak law that would preempt cities and states from doing something. So I see this as a real legal threat to deploying the soda taxes in a broader way over time, and a legal strategy needs to be developed and a legislative strategy to help prevent this. So I'll end there just by saying that I'm very happy to be involved in this discussion. It was very interesting to me to hear Dr. Chan, Bill Dietz, talk about soda taxes, and sugared beverages came up a number of times today, so they're certainly on the national radar and the scientific radar. And thanks to the good work of the Robert Wood Johnson Foundation, now WHO, a strong advocacy community around the country, real progress is being made. So I expect we're seeing just the very beginnings of what will be a much larger movement going forward. Thank you.
So.